So today we're going to talk about disease prevention in the shelter, and this is geared towards shelter management, and I think this is the perfect audience for this lecture because shelter management has such a huge role to play in preventing the animals that come into your shelters from having anything bad happen to them there. First, a little bit on sort of my background in terms of sheltering. So I started volunteering to walk dogs at a shelter when I was in college because I missed my own family pets. And I got a little bit involved when I was in veterinary school as well, mostly because it took me about 2 weeks of veterinary school to realize that veterinary medicine is a business. I don't know what I was thinking before that. And then I realized that I'm not actually a business person and I really hate asking people for money. And so this was probably going to be a problem for me going forward in my career until I started working at the Animal Humane Society in Minneapolis as a part-time job to support my student loans during veterinary school. And then I realized that I was going to be just fine. Because as long as I stayed in shelters for the rest of my life, I didn't ever really have to ask anybody for money, which is great. I also love shelters for a lot of other reasons too. But this is Lily. This is one of my first foster cats. I had her in my house with me for about 4 months because she had babies. I took her home when the babies were tiny, tiny little like mouse-like creatures. And then as soon as we were done with those kittens, they were all grown up, they had surgery, they went back to the shelter. We had a couple more motherless kittens come into the shelter that were little tiny mouse-like creatures, and we grafted them on her, and then I had her for another 8 weeks while those kittens all grew up. So she was fantastic. I loved Lily. She was the best cat ever, but I was a really good foster mom and really conscientious, and I gave her back to the shelter when she was done with her mothering process, and she got adopted by somebody else. And I'm sure she's doing fine, but I still miss her. So preventive medicine is a specialty in human medicine as well as veterinary medicine. And these are two specialties that, like many, don't often talk to each other, but when we do, we discover a lot of things that are the same about humans and pets. The preventive medicine people are really focused on communities and populations, both in human medicine and in veterinary medicine, and we have some similar goals. So we want to protect health, we want to promote health that is already there, and we want to maintain the sort of healthy status quo of people that don't have any diseases. And if you have people that have conditions or diseases, or animals that have conditions or diseases, we want to prevent them from getting worse, to prevent any sort of permanent changes to those animals, and we also want to prevent diseases from coming to them and death if we can. So sheltering, kind of one of the first things that I got really concerned about was euthanasia in shelters. When I started out, we were euthanizing probably about 75% of the animals that came into shelters on a regular basis. Euthanasia at that point in time in the shelter was the biggest cause of death of small animals in the United States. And if you think about it, if that was a disease, people would be really, really upset about it, right? But it took a while, I think, for people to understand exactly what that impact was on the animals, on the people who were being asked to do those euthanasias, and sort of on our communities as a whole when those people went out into those communities. And so it's not just diseases that sort of process is concerning for, it's also sort of the mental health aspect of it that really is interesting to me. I'm going to put this here. I really, really believe this statement. And I think that this is something that a lot of people struggle with in the shelter. How many of you guys agree with this, that animals should come in to a shelter, stay, and leave as healthy or healthier than they came in? How many of you guys feel like this happens on a regular basis in your shelter? That's great. There's a lot of hands, but there's a lot of hands going like maybe, most of the time, some of the time. It's definitely not always been the case, right? It's more so now, but in the past, most animals came to the shelter and the first thing that happened to them was they got sick, right? And I think that we can all kind of understand that that's something that we want to avoid, and we actually have a lot of tools now and information now that we can use to keep animals healthy that maybe we didn't know even 5 years ago. So what are some challenges to keeping animals healthy when they come into your shelter? Just shout them out. Stress, yes. Knowing the background of the animal, yep. Anything else? So you guys have plenty of money. in your shelters, right? Money, right? What did you say? Housing. Mm-hmm. Absolutely, absolutely. Finding enough housing for everybody. Everybody have enough staff? Yeah, you have more than you need, right? Okay, so there is a lot of common challenges that every shelter faces. And I would say that these are challenges for people who own pets too. So we have, I just threw a bunch of them up there, budget, staff time, caged housing, time in the shelter, behavior issues, sick pets, precedent. How many of you guys do things in shelters that you've been doing because that's the way they've been done for the last 25 years? And you still don't know why you're doing them that way. Okay. And they all kind of boil down, these two things, to two things, I think, in particular: stress of the animals and biosecurity. Everybody kind of understand how that works? So just real quick, when does our responsibility to these animals that are coming into the shelter start? Is it when they come in, or maybe not quite even then? What about before? So I would argue that sometimes for certain animals, the best intake is not to take them in at all. So for this guy, for example, who's he? He's a feral cat. Yeah, he's actually doing really well for himself, isn't he? He's not exactly a BCS like 3 or... He's got a small ear tip, yeah, but he is neutered and he is vaccinated and he has had a veterinary exam. It might have been while he was out under anesthesia, but he's done all those things and he is doing just fine in his environment. He does not need to come into the shelter. Correct. So this is an interesting story too. So this was a pit bull who was attacked by some crazy person with a knife. Pit bull is super nice, has a really caring owner. Owner has no resources. And so this started out as a forensic exam and ended up being the pit bull getting admitted to the shelter so that he could receive the medical care that he needed, because his owners had no resources to do this at any regular veterinary hospital. But the owners really care about this dog. The dog really cares about the owners. He's a big sort of older pit bull dog of which that shelter had multiple that were already available for adoption and not moving anywhere. And so this shelter made the decision to do all the care and then keep that dog with its family. And that's not something that they do for everybody. It's not something that they advertise that they do to anybody, because of course you'd have a lot of people knocking on your door. But in this particular context, in this particular situation, it was absolutely the best decision that the shelter made to keep that dog with its family, provide the services that it would have provided anyway if the dog had been admitted to the shelter and then gone through the regular sheltering process. Also, in addition to all of his stitches here, the dog got neutered. So don't worry about that. We're fine. And then this is a dog who showed up at a veterinary clinic who is a stray dog. And the veterinary clinic called the shelter and said, hey, we have a stray. And the shelter said, have you scanned it? So they scanned it. They found a microchip. They found the owner's name. They called the owner. The owner came to the veterinary clinic to pick it up. So that dog didn't need to come to the shelter at all. And that's great when you have pets that are microchipped and when those microchips are registered. Doesn't work out if either one of those things is missing so much. But these are all times when really it's probably best not to take these animals in at all. And if we can avoid them, this is the best preventive medicine that we have for preventing those animals from getting sick in the shelter, and also preventing the separation of this poor animal from his people and vice versa. But sometimes it really is the best place for an animal. And we'll get to that in just a second. So first I want to talk a little bit about biosecurity. So do you guys know what biosecurity means? Anybody want to shout? No? No takers? Nobody want to define? Cleaning, disinfection. Right. Right, it's protocol. So this is basically our way of saying we're going to separate the biological disease components slash sort of anything that animal might be shedding from one animal to another animal. So we're putting a barrier there between the germs this animal might be carrying and the germs that maybe I might be carrying. Does that kind of make sense? Or maybe that animal and its environment. And so there's a lot of different ways of doing biosecurity. And you want to do this type of thing, this type of biosecurity, I'm talking about biological biosecurity here, on intake for the animals that are coming into your shelter, because this is the way that you either set them up for success so they don't get a particular disease, or you treat the disease that they already have so they're not shedding into your environment anymore. It's much easier if you stop those parasites at the door than it is to clean them out of your environment when you're cleaning later. Does that kind of make sense? So this is the first thing that I think of when I think of biosecurity for animals coming into the shelter. I think of vaccination, because I know that my shelter environment is probably the place where they're going to get sick if they're going to get sick from something that my vaccines can prevent. So for cats, it's the FVRCP. For dogs, it's the DA2PP and the Bordetella intranasal. The next thing I think of is worms. So like I said, you want to prevent that shedding from happening even before they come into their kenneled environment. Way easier to get those parasites out if you don't even have them there in the first place, right? So treating on intake with pyrantel, super important because it gets those two parasites that are actually zoonotic to people, the roundworms and the hookworms. And that's our responsibility to keep our staff safe and also our public safe when we adopt these animals out eventually, right? How many of you guys are using marquee paste on intake? Yeah, I see a couple of hands. So this is a medication that's good against coccidia. Coccidia and giardia are two parasites that will leave cysts in the environment and are extremely hard to get out. So almost no disinfectants will kill the cysts that the coccidia and the giardia leave. Steam cleaning works, but you put as much bleach as you want on there, you put as much rescue on there as you want, and it's not going to kill them. So it's very nice to treat at intake so that you don't have them in the environment to start with. Tapeworms, if you have animals that have fleas or if you have animals that may be predating other animals, cats that like to eat mice, that sort of thing, it's nice to get those mostly because people find them very disgusting. And it's better for your adopters so they don't have to call you and say, hey, there's worms in my cat's moving around, little grains of rice. Flea treatment, I think that's essential for animals that are coming into the shelter. The fewer fleas that are on that animal as it's sitting in its cage, the fewer fleas will go on to the next animal, the next cage over, right? And then how many people are snap testing cats and dogs when they come into the shelter? Quite a few people. How many people woods lamp on intake? Oh, not that many. Yeah, okay, so I would definitely recommend if you are worried about ringworm in your cat population that everybody gets woods lamped on their way into the shelter. And this way you prevent the transmission of ringworm not only from one cat to another, but from cats to people in your shelter. So isn't it that some glow and some don't? So recent research has suggested that almost 75% of cats that are infected do glow, which is enough of a number for me to highly recommend it. And then if you have cats that are coming in litters, how many people have kittens that come in one at a time? Not very many. So you can actually use that as a diagnostic technique because most of the time an entire litter will be infected, 3/4 of them will glow. So you can capitalize on that to actually increase your sensitivity of that woods lamp. So highly recommend doing that. You will cut down on the ringworm transmissions not only from cat to cat in your shelter, but also from cat to human in your shelter. And then spay neuter. So these are kind of all of the things that we do on intake and sort of very close to intake to try to keep our populations as very healthy as possible. People are pretty comfortable with these, right? So these are the ones that I think if you have a shelter with very, very limited resources, these are the ones that are absolutely essential on intake because these are the ones that are going to prevent outbreaks and really improve the health of your shelter going forward. So biosecurity, have you guys watched these ASPCA How to Clean videos? Have you shown them to your staff? They're fantastic teaching videos for how to clean kennels in the shelter. I think they're really, really great. So you guys all know this because you teach your staff how to do this as managers. So you remove the debris. What's the next step after that? I'm hearing, yep, some mechanical cleaning detergent. So yeah, you want to scrub with the detergent, soap suds everything with the soap suds everywhere. What next step you want to do? Rinse, great. Next step? Disinfect, perfect. And what do you do with that disinfectant? Rinse. Well, you rinse it, but first, before you rinse it, you leave it for a particular amount of time depending on which one you use. Perfect. You guys are all pros at this, so I didn't want to take too long doing this, but this is a really great way to make sure that the environment is not contaminating the animal, and that if the animal had contaminated that environment previously, that you're taking care of that. So great way to prevent disease in your shelter passing from one animal to another. So I've got a couple different disinfectants. These are the most popular ones that shelters use these days. How many people are using trifectant? How many people love the smell of trifectant? Yeah, okay. How many people are using bleach? Couple. How many people are using Excel, Rescue, whatever you want to call it? There's a lot of people. Excellent. Okay, great. I like all three of them. All three of them probably get pretty much everything that you want to get in the shelter, including, we think there's actually some new evidence about trifectant probably getting ringworm as well. So that's comforting. There's still more biosecurities that we can talk about. So we talked about now biosecurity of the animal's sort of biome. We talked about the biosecurity of the kennel environment. Biosecurity of you. So it's really important that you also take care of yourself when you're in the shelter and you're wearing the right type of equipment for the environment that you're in. So if you're out mucking out the dog yard, you should be wearing the right type of equipment so that you don't get sick from what the animals have left behind, or vice versa, I suppose. So making sure that you're wearing boots if you're out there mucking out runs. Make sure if you are handling fractious cats that you are wearing the appropriate type of garment so that you don't get hurt. Dog bites and cat bites are a huge biosecurity concern because if their mouths are contaminating your skin, then that's another source of infection. Making sure that you're wearing masks if you are, for example, mixing up trifectant or doing other types of tasks so that you don't hurt yourself. If you're going to respond to a cat hoarding situation, for example, you're going to need a mask that's a lot better than this one. Eye protection. So how many of you guys have had eye problems or got anything in your eye working in an animal shelter? I know I have, doing this. So how many of you have had lime sulfur in your eyeballs? Oh, it hurts so bad. Make sure you're wearing goggles when you do that so you don't get anything in your eyeballs. This person is wearing her logo t-shirt. She's wearing her gown. She's wearing her gloves so that she can, A, not get ringworm, and B, not get lime sulfur all over herself. So these are ways that we keep ourselves healthy, but also then don't transmit things from one animal to another in the animal shelter. So these are all great ways to prevent things from going bad in the shelter. What's a fomite? Yeah, great. So it's an inanimate object that can pass sort of biological agents from one animal to another. Sometimes that inanimate object is something that's attached to an animate person. So this was one of the first inanimate objects that I learned about as a fomite because I have relatives who are MDs, and they were actually told that they shouldn't be wearing neckties when they were working with patients anymore because they were dragging their ties through things and then wearing them, seeing the next patient, wearing them, seeing the next patient, and actually they were contaminating people. Hands are great fomites. They are animate, I guess, because they are attached to my brain, but you make sure that people are washing hands. Gloved hands can also be fomites for two reasons. One, if you don't take your gloves off in between touching animals, so that's one thing that you can see. The other one is most people don't realize when you're taking your gloves off, you can actually contaminate your hands with what's on your gloves too. So washing your hands in between taking gloves off if you need to. One of the easiest ways to tell, I've had people dunk their hands in water with food coloring and then take them off, and you see how much food coloring is on the rest of your hands, and it's actually quite a lot. So something to actually practice. You can practice taking gloves on and off the right way, and there are videos online. Cat toys are great fomites. I see volunteers just picking up a mouse off the floor and putting it in a random cat cage all the time, and I don't know which cat cage that mouse came from. I'm sure some kitten kicked it out, right? But then it's going probably into a different cat cage the next time. So I like having washable cat toys that we go from cage to cage. If one hits the floor, it just goes in the laundry and then comes back out again and then goes in a different cat cage. Leashes. How many of you guys have a leash and you use the same leash for every dog that you're walking? Probably not the best idea if they have anything on them to contaminate themselves. I recommend having one leash per dog, and everybody uses that one leash for that dog. They can go in the laundry too. Scrub tops. If you're not changing your scrub top and you're holding animals like this and then you hold the next animal like this, you certainly can pass germs from one animal to another in that manner. And then this is one of my favorite ones for students because they're very concerned about changing their gloves in between each animal, especially when we're doing surgical exams the day of surgery, and they're going from cat to cat to cat in our surgical ward doing their physical exams. They'll change their gloves, and then they'll have the same stethoscope, and then they'll change their gloves and they'll have the same stethoscope as they're going from cage to cage to cage to cage. We have wipes. We have Excel wipes that are meant to be used for your stethoscope in between every animal, but it's hard to remember to do that sometimes. So just something to think about in terms of not spreading disease from one animal to another. You have perfect biosecurity in your shelter. I'm granting you that. Is that enough to keep your animals healthy? No. Okay, great. I like that answer. This is why, one of the reasons why. So I'm not going to spend a huge amount of time on this slide. This is a herpes virus. These are little antibodies that are attached to the herpes virus. There's a couple studies that show that even though vaccination can really help the amount of symptoms that you see with the cats that have herpes virus, in one particular challenge, 8 out of 11 control cats that were never exposed to herpes virus or that never had a vaccine, and 7 out of 11 vaccinated cats all were shedding virus when they were exposed to the virus. Did I muddle that up too much for you guys? So they had 2 groups. One group didn't get a vaccine, one group did. Both groups are shedding virus when they're exposed, equally badly. The other studies that are important for you guys to know is that about 1/3 of all household cats have been exposed to herpes virus already, and so it doesn't matter if you vaccinate them because they already have it. And then in the shelter, between 63% and 84% of cats that come in already have herpes virus. Or the other thing about herpes is not only that it goes away, but it just kind of hides. In cats, it hides in that trigeminal nerve in their face. But also, it's there for life. So once you get infected, it's there no matter what you try to do to get rid of it. So then when they get stressed out, they recrudesce. And this is what that looks like. So this is from a study in a shelter that had really good biosecurity. And those sort of 2x2 metal shoreline stainless steel kennels. And every cat that came in was looked at. They did stray cats and own cats. And all those cats here, look at this line, this FHV line. So 2% of them on intake were shedding herpes virus. And then 3 days later, 5% are shedding. And then 8 days later, 10% are shedding. And you can see that it just goes up and up and up and up and up the longer they spend in the shelter, right? So this is kind of what we're fighting, right? They've got time, days in shelter. So this is 40 days in the shelter. This is a long length of stay. Hopefully they don't stay that long. But if you have this many cats, then you think about how many cats here that are shedding, that are starting to have symptoms, that are going into isolation and staying there for however long, right? So that ends up being a huge problem, not only for your cats that are sick, and then potentially spreading this disease to the other 20% or however many cats that don't have this disease, but also now you have these longer lengths of stay because they all have to go to isolation before they get out, and then they are still maybe snuffling a little bit, and then they don't look that great, they go out for adoption. People don't want to take them home because they look sick, right? So it creates a lot of problems. So how do we stop that cycle? How do we not have that graph going up like that? Well, there are actually a couple papers out recently and some work that's been done for a while that actually has a really nice answer to that actual question. And one that most shelters can actually do. And the answer to preventing URI, of course, as we just talked about, is preventing stress. So how do we prevent stress according to these papers? Well, I'm not sure if we can actually prevent it, but we can manage it. So the first one is to provide a sort of enriched environment, enriched life for the animals. And this is the sheep one. I did the sheep one because I think these sheep are super cute. And also to remind us that it's not just cats that get stressed out and sick in the shelter. So dogs can do this too, guinea pigs can do this too, rabbits can do this too. And so every animal that comes into your shelter needs their 5 freedoms taken care of. And this is one of the best ways that we know of to actually prevent all of the diseases that we're talking about today. So the other reason I like this one is because good lifestyle is the #1. And I think it really is. They need to be able to express normal behavior patterns. They need sufficient space. They need suitable facilities for them, and they need company of their fellow fill in the blank, right? Unless they hate other cats, in which case they can stay by themselves. They need good nutrition. We don't seem to struggle with that one quite as much in the shelter. We all have usually enough food to take care of all of our animals. They need a good environment. So they need freedom from discomfort through the right temperatures, the right sound levels, the right sort of roofs over their heads. They need good handling. That one can be kind of challenging in the shelter too, right? How many cats do you have to pick up and move out of the kennels to clean them every day? It can be a lot. And then they need good health. And I think that as shelters, we're getting better and better at this one. So the ones that I think are the most challenging still, the ones that we struggle with the most, are these two. So the good lifestyle one and the good handling one. And for those of you guys who went to the fear-free lectures, that's taken care of. That's sort of what this is all about, and I think that people are starting to get way better at this, even in vet schools, which is great. I think they have a lot of trouble with this too. But the good lifestyle one is still really hard for us. We want to know what that good lifestyle is for cats. Well, it turns out that a lot of it is about size. So size ends up mattering quite a lot. So the cat cage size matters quite a lot. The population of size. I'm focusing on cats here because most people in the Northeast are mostly dealing with cats, but it also applies to dogs. And staff size. So these are the three things I think that we struggle with the most in the shelters to provide that good environment. And then, of course, budget size. And that's one of those things that this actually can help you with, even though it doesn't actually change the amount of money coming into your shelter. And I'll show you why. So this is a study out of Davis. They've been talking about this data for a really, really long time. They finally published it because I'm so excited that I can share it with you instead of sharing these random slides that I stole from their presentations online like a while ago. So this is the shelter monthly feline URI rate. And these are 9 different shelters, all these different colors. Can you guys see this in the back? So there's some shelters that have a really high rate of upper respiratory, so a lot of their population is sick. This is URI rate, so it's percentage. So this shelter, 80% of their cats are sneezing. In this one down here, this yellow shelter, 0, 0, oh, 2%, nope, 0, 0, 0. So what are they doing in this yellow shelter that they're not doing in this stripy shelter? Well, a couple things. 2 things, in fact. Things that are all sort of actually doable for shelters. Number 1 is their intake housing floor space is greater than 8 square feet. So those cages are not 2 by 2. Those cages are more like 4 by 2. By the way, if you're from Canada, this is 0.8 square meters. Okay. 2 or fewer housing moves during the first week of stay. So they didn't get shuffled from cage to cage to cage. They just stayed where they were, maybe moved to surgery, maybe moved to the adoption floor, but that was it. They didn't get moved to cage over here in this room. They didn't move to cage over there in that room. They just kind of mostly stayed where they were. Does that seem doable? Like, that's it. Like, that's the only real difference that they found. This is how it's doable, right? You guys thought you were going to come to a lecture and not get portaled. Yeah, well, sorry, you get portaled. So I love putting portals in. I don't know. This is our technician, Vicki, here. She's got all of her PPE on for doing this. Eye protection, ear protection is absolutely critical for this. You can actually use it in your shelter as a promotion. So this is a shelter that we worked with about 10 days ago. They put this up on their Facebook that they're going to be closed on Friday because we're putting portals in all the cat cages. And isn't this wonderful? And give us money, right? They got some donations because people were really excited about this. And this is us actually doing it, putting those portals in. This is Dr. Henry here. And I think she was lecturing in this track earlier. So we managed to put in 30 portals in one day. So that's 30 kennels. That used to be 60 kennels. And they are now all trained up, and they can put their portals in the rest of their kennels. And those cats are going to have a lot better chances of getting out of there without going through isolation and getting sick. So the other thing that's nice about portals, and remember how I talked about this balance between stress and biosecurity? Look at this biosecurity. She's cleaning. She's cleaning here. She's cleaning, replacing the food. She's making the towel all nice. She's getting rid of all the paper plates where the wet food was and putting new wet food in on nice, clean stuff. And she's not touching that cat at all. And the cat's not going into a carrier, and the cat's not going one cage over. The cat is just in its own kennel, in its own space. And then when she's done with this side, she'll close the door, remove the little sort of flappy thing that closes the portal, invite the cat over to the other side by maybe some gesticulation or maybe a wand toy or something like that, reach in the other side and close it, and never handle that cat. So here we have a grumpy cat. Now no longer, it's not actually a bite threat to any of your staff anymore. Here we have a ringworm cat. Guess what? They don't have to handle it at all. They can just clean that kennel without any worries. If we have a cat that has upper respiratory, you don't have germs all over your clothes and all over your gloves. And so it not only makes for great biosecurity, but that cat doesn't get moved into a kennel, doesn't get moved into a carrier, doesn't get moved anywhere it doesn't want to be. Remember how those moves were important? So now we also have less stress for those animals. So there's probably a lot of different reasons why making those portals makes such a huge difference in the upper respiratory rates in these shelters. So, but then if that's the case, right, why have cages at all? Well, first of all, biosecurity, right? So if you just, this is a cat cafe in Japan. They had about 40 square feet and about 80 cats. Yeah, so I was a little stressed out there. I don't know about the cats, I think they were too, but my hair was like, whoa, what is going on here? And they were like, here, you want a coffee? And I'm like, not really. I don't want to eat in this environment. And I'm like, okay, I think I feel like what the cats are feeling. Biosecurity is a huge thing. You don't know where those cats came from. You don't know what they're shedding. You don't know if they have ringworm. You don't know any of these things. And then all of a sudden they're put in this group room without any sort of screening. That can be a huge problem. If you have cage-free housing, you want to maintain that cage-free housing, please come talk to me. There's a lot of different ways that we can help you out there. But in terms of long-term cats, I think that group housing is great. I just want to make sure that they're healthy and parasite-free and retrovirus-free before I mix them in with another animal. Kittens, also complicated. I think that most of the time they get adopted out before you even need to put them in that long-term housing, or at least they should. And if you're not doing it that way, then come talk to me too, because we might have some more solutions for you. But adult cats, I think group housing, great solution for those long-termers, if they like other cats. What about foster home capacity? So if you could send all your animals to foster and not have a brick and mortar shelter, there's a lot of organizations that's how they operate. As long as you're not mixing litters or mixing cats in those foster homes are acting as those portaled cages, and I think that's just fine. So, and then how to know what numbers to look at. So let's talk a little bit about that second size matters thing, and this is size of your population. So say you have a shelter that has 200 cat cages, 90% live release rate, and your current length of stay is about 28 days, right? So 4 weeks. This is about normal for most shelters, I would say. If you have 3,000 cats that you intake every year, I'm trying to make this a medium-sized shelter, that means that you adopt out 2,700 cats. This is just straight-up math. And 300 cats get euthanized every year for, let's say, very good reasons, like they're sick when they come in. That breaks down to about 7.5 adoptions per day. And of course, we're not adopting out half cats. And of course, cats don't all come in at the same time, right? So this is dogs. This is the 2017 Shelter Animals Count report. This is how many of you guys report your numbers out to Shelter Animals Count? Awesome. If you're not doing that, please, please, please do. This is the very best way we have of knowing what's actually going on in shelters, numbers-wise, across the country. And I probably think that there's about half of shelters and shelter animals out there that are not getting counted in this particular survey. So please, please report if you can. But so like I was saying, this red line here, that's dogs. This blue line here, this is cats. This is January. This is June. And this is December. So this is Kitten Mountain. And so the 7.5 per day is like this sort of dog number, right? And it doesn't actually reflect the reality of what happens in shelters. So I like to say a range. So we'll say 5 to 10 cats and kittens per day, which then works out to 75 to 150 cats in the shelter at any given time. So I'm going to arbitrarily say, what if my cats only stayed for 14 days instead of 28 days? How many kennels would I need? Because I want them to stay 14 days. I don't really want them to stay 4 weeks. I would like them to stay 2 weeks. So that means that our maximum capacity is about 150 cats. So we have 200 cages, so that's pretty good. But 250, this is not 150 cats. This is not the same number all year long, right? So this is this number here. And our kittens, do they all need single cages? They all come in one at a time, right? No, we established that before. They don't do that. So I would probably say you need about 100 kennels, because then you can put 2 kittens per kennel, which is a nice number. or maybe 3, and then your adults can all have their own solo kennels. So you actually need about 100 kennels, which is super convenient when you look at this number and you think, oh, what if I put portals in? Then it turns out that I only need 100 cats. And then if I do that and they're still leaving at the same rate, it turns out that they only stay for 14 days. So if you do this, if you then change your kennels so that you only have 100 of them, how many animals do you end up adopting out every year? Is it the same number? Is it a different number? It turns out it's exactly the same number. They're just staying less time. So you end up helping the same number of animals and doing half the work. So that's pretty cool. I'm going to continue this math theme here for just a couple more slides, so sorry. Also, it's not magic. So we talked about staff constraints. You know, people were laughing when I said, oh, everybody has enough staff, right? Well, so this is the constraints that we have. So animals, according to the ASV guidelines, need to spend the majority of their time in a clean enclosure, which is why we all clean in the morning and then sort of spot clean throughout the day, right? They also say that you should spend 15 minutes per animal per day cleaning and feeding. And this is sort of an estimate. Your shelters might be a little bit different. You can get the number that you need by watching your staff do this. So if you time them per kennel and then get an average number, that will give you a really good idea. Maybe not this 15 minutes, maybe it's only 9, maybe it's 20. It depends on your staff, right? And then the ASV guidelines also say that you have to have rounds conducted at least once every 24 hours by a trained individual. Who feels like they have plenty of time for rounds? It's a struggle getting people to come on rounds, and I try to make it really fun. And I still have trouble getting people to come with me. So what if I said I could free up some time for you? What if I said I can give you the exact number of staff that you really need? Well, I can. More math, not magic, math. So here's your shelter. Again, you've got those 200 cat cages, and you've got your 50 dog kennels, and you adopt out the same number of cats every year like we talked about, and that you have that medium length of stay is 27 days. If your shelter is full and it takes 15 minutes per animal to clean, that means you need 62.5 hours to clean all of your animals and feed them. So that's a lot. That's obviously impossible for one person to do. So then you hire more people, but you also need to do this all before the public get there, right? So if your shelter opens at noon, that means you need 15 people cleaning cat kennels, cleaning dog kennels, feeding everybody to make sure that everything is ready in the morning. So they spend the majority of their day doing this, and also do rounds during that time. I didn't actually leave any time for that. Oh, I did actually throw this in here. So if you change this to 100 cats, then cat cages, right? Then it only takes 37.5 hours to clean, and you only need 8 people to do this, which seems a lot less daunting than 15, right? And look at that, your length of stay just dropped to 14 days. Magically, not magically, math, it's math. The other thing that I would say about this is with those double kennels, it makes spot cleaning so much easier. So instead of going in there and having to clean everything out and put everything back in, you can just empty the litter box, refresh the food and water, kind of pat things down a little bit, make sure nobody peed anywhere they shouldn't have, and you're done. So it then takes far less time to clean, and probably way less than those 9 minutes that NACA said that you needed. The same is true with dogs, by the way. We've actually have studies that show that if you have a dog that has a dual compartment kennel, that they will eliminate on the side that's away from their food and bed pretty much 100% of the time, probably like 98% of the time. Depends on if they're potty trained or not, right, and how old they are. But how nice is that, to just have to clean one half of the dog's enclosure and then have the guillotine door down while you're doing it so you don't have to move them anywhere. So that cuts down on your time as well. So how then do you get that length of stay down to that 14 days so you can have the sort of population that can fit in your newly smaller shelter and your newly smaller population? Well, there's a couple of different things. So the first thing would be actually adjust your populations to match your outflow. Winter is the best time to do this. So get those kennels all portaled in the winter when you already have a low population. And if you can, do this when you know that you can get more cats out of the shelter. So figuring out what that number is really important. The next thing is to have daily rounds, to actually do those daily rounds. You know, when we were in Dr. McCobb's lecture earlier, she was talking about not in this room, but in the other room, how a drug company had let go all of their quality control and efficiency experts. This is your quality control and efficiency, these daily rounds. This is where you don't lose any cats through the cracks. This is where you make plans for your long-term stay cats. This is where you make plans for your very, very short-term kitten stays. This is where you get everybody on the right place, exactly where they need to be, when they need to be there. And the more you can do that, the more days you can shave off of their length of stay. Immediately treating and managing injuries and signs of disease. So if you do your daily rounds, you will see very early signs of illness. You will see immediately when somebody has injured themselves. And the earlier you can treat, this is the preventive medicine principle, the earlier that treatment comes in, the shorter the course of that treatment will need to be. Or the shorter the length of stay of that animal in the shelter. Does that make sense? Identify bottlenecks and adjust staff where needed. So if you have your cat cleaners and they're all done by, say, 10:30, and your dog cleaners are still in their boots and scrubbing to 12:30 and your shelter opens at noon, it probably means you don't have enough staff in your dogs and you have too many staff in your cats. And you can move them around so that you end up finishing at the same time, on time, every day. And then if you finish on time or even early, then the kennels and the cattery staff can join you on rounds. So that's exactly what you want. Reviewing timing and statistics regularly and adjusting as needed. So this month, for some reason, we have so many dentals, we are scheduling them a month in advance. So that's a problem, right? I don't want this cat sitting around in my shelter for a month because it needs a dental. So I have a couple things that I can do about it. One is I can add a surgery day where the surgeons come in and they do more dentals. Or I can make a memo and decide that for this month, we're just going to adopt out moderate dental disease. We're not going to clean those teeth. We're going to say, I'm sorry, this cat is coming as is. You understand by adopting this cat that you're going to have to go and get its teeth cleaned at some point. That's up to the adopter. If they say, yes, okay, I want to do that, then that's on them to do it. And that's okay, as long as you make that disclosure, right? So that's what I mean by adjust as needed. Open, easy adoptions. So this is one of those things that we've been talking about for years. It is probably a very hard thing for, this is, I think, where the precedent comes in when I say that precedent holds us back. Because people who have been trained in adoptions and have been taught how to do adoptions for a very long time have probably heard 5 or 7 different philosophies behind adoptions. One of those is, I need to make sure that this animal goes to the very, very, very best home possible and never comes back into the shelter. What that does, unfortunately, is it requires that adoption counselor, to be the judge, jury, and executioner for that adopter. So it asks them to evaluate that person and their ability to care for a pet when they really don't have enough information to do it. And there's a lot of people who have been doing that for such a long time that they truly believe that they have that ability to do it. And I would like to challenge that. So I think that the very best thing that we can do is trust adopters to knowing when they can have the capacity to take care of an animal, and to trust them that if it doesn't work out, that they'll bring the animal back and I will adopt it out to somebody else. Shelters that have open adoptions have the same return rates as shelters that don't. They just have shorter lengths of stay. And there are papers that show that. I didn't reference them here, but if you want to know about them, come and talk to me. Some great ideas that I've had learned from other shelters that I've consulted with. Foster homes on deck. I really, really like these. So what this is, and it can be a variety of different formats at Tompkins County, this is a Google document. And all of the fosters, the cat fosters, especially kitten fosters, have access to this document. And it says, you are next up in getting a litter. Watch out, because we're going to call you here in the next couple of days, and you're going to be asked to come in same day, pick up this litter, and take it home. And when we tell you to come in and pick it up, take it home, we will have everything that you need for that litter of kittens when you come to the door. So it's a 15-minute process for you to come in, grab those kittens, leave, and those kittens are maybe in the shelter for an hour or 2 before they go to their foster home. So that shortens the length of stay of those kittens in our shelter, and then also shortens the amount of time that we're waiting for, help, 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 we need foster people. Anybody want this kitten? Anybody? When you have somebody specifically that you can name, their responsibility goes way up. So I highly recommend that. Also recommend that for barn homes for cats that are feral and you can't put back where they came from. Because this happens from time to time. Somebody has an animal on their property, they bring it to you because they really hate that animal and they really don't want it on their property. Where does it go? Well, it either goes in the freezer or it goes to a barn home. Usually we try to find some sort of working cat placement for it. But that working cat placement can be very hard to find. I'm sure you guys are all struggling with that because we have more cats in this particular category than we have barn homes for it. But if you have a list of people that are looking for barn homes or looking for cats for their barns or looking for a working cat for their garage or looking for a mouser for whatever particular reason and they don't care if the cat's friendly or not, great, create a list so they know that as soon as one comes in, it will get spayed, neutered, vaccinated, examined, and sent to them. And try to encourage them not to be picky about what they want. Because some people are like, well, I only like orange cats, I only like girls, and you're like, guess what, it's a cat. You're not going to interact with it anyway, so it doesn't really matter. Yeah, Maddie's fund, Austin Pets Alive, has resources for barn cats and how to have a successful barn cat program. Special needs adoptions contacts. So we get in healthy-looking cats that have FELV periodically. Not all the time, but maybe like once or twice a year. In our shelter, it's about 1,000 cats a year. So I know that this is going to happen, and I know that I'm not going to want to euthanize the cat. And so I have somebody who is willing to take this cat already in line. Then I have a very easy process of knowing what to do with this cat. Same thing might be true with diabetes. Same thing might be true with early renal failure. So if I have a person I know in the community who says, I want to challenge, or I have a place in my FELV colony, or I am willing to take on a special adoption, keep that person's information, guard it, call them as soon as you can when you have a cat like that that comes in. So it's no longer a struggle for you to find those really, really difficult placements, and those cats don't languish in the shelter because nobody wants to euthanize them. Special promos. So there's actually a lot of evidence out there that having special promotions, so things like BOGOs, things like name your own adoption price, things like free adoptions, don't increase returns. And the people who adopt cats or dogs with those particular promotions care about them just as much as the people who paid full price. So there's no reason not to do this. If you need to, for example, clear cats out of your shelter so you can put portals in. So these are some good ideas for like spanning that biosecurity stress management situation. So I really like target training. This is a Jackson Galaxy cat. This is also a catnip sock. So they're target training. Cats are teaching them how to high five. Look how he's wearing gloves. I love that. Make me really, really happy. Because Jackson Galaxy, going in there and he's got his guitar case and he's really great guy. He doesn't always have the best biosecurity. But this particular picture made me really, really happy. Which is not to say I love what he's doing. I love what he's doing. I just wish that he wore gloves sometimes. Stress management, I love catnip bubbles because I don't have to touch cats. The cats love them. They can chase after them, especially the kittens go bonkers. And it's a really great way of playing with a cat without using anything that could possibly be a fomite, right? They also make edible bubbles with different flavors, like grape and things like that. They don't actually have any grapes in them, so you can still use them for dogs. And then hiding places. So if you have a cat that just really doesn't want to hang out with you, that's okay. He doesn't need bubbles. He doesn't need to be trained to high five. He just needs a place to hang out until he goes back into the field. And that's totally fine, too. So individual cats respecting what they need, respecting what they need, respecting what they need so that they can go home. Basically, what this whole presentation is about is encouraging you to operate within your means, which is a really kind of depressing statement, right? What it implies is that there are all these barriers, these limits that you have to work around. I actually don't like that very much. What I really like is this. What this whole presentation I hope you take away from is how to maximize your shelter's life-saving potential by preventing anything bad from happening to your population so that they can be healthy enough to adopt out really fast so that you can have the capacity to help more animals coming in. These are all the things that we prevented today. So feral kittens, unwanted litters, URI, time in isolation, antibiotic resistance, because if you don't have a URI, you're not giving them antibiotics when you don't need it. Loss of smell, sight, and appetite for that cat. Behavior problems, overjudging adopters, roundworm recrudescence, flea tick-borne disease, environmental contamination, I debated in high school, so I talk really fast sometimes. Family separation, unnecessary shelter intakes, contamination, time, money, poor use of shelter resources, and disease outbreaks. You guys look cool with that? You want to prevent all those things in your shelter? Excellent. Excellent. All right. Great. All right. Enjoy your lunch. Thank you.